right. Welcome in to All Things Odd. I'm Dr. Natalie Phillips.
And I'm Dr. Hannah Galloway.
And we have an exciting topic for you today. But before we get there, we will get some people joined in here. And I'm going to have Dr. Galloway talk about our YouTube channel.
Yes, so this is our YouTube channel. You guys are listening to us because we've gotten 2 more subscribers over the last couple weeks. But I like the YouTube page, one, for people that don't have Facebook, if you wanted to like send out the show to somebody. But also I like the way it's organized and how you can kind of see the thumbnail images to tell what the show is about if you want to, just listen to certain topics. So if you go to our YouTube channel, you can subscribe. I think it's in the top right. It's usually like a red something. And it might not show on ours, but it should let you subscribe to our YouTube channel. And that way it'll notify you too if we have a new episode.
Yeah. All right. And so we are posting this in some of our favorite audiology groups to get some people to join in here. But man, we've got a really interesting topic. And for this topic today, okay, the reason why we came up with this is because we had a patient come in, and I'm going to put it up here. So as people are kind of coming in, they're going to be like, what are you talking about? Okay. So it's called swallow syncope. But we had a patient come in, and it was really interesting because we see a lot of people from our brain injury and concussion specialists, and we'll probably try to see if we can kind of get him on the show again here. But this particular patient came in because she told us that while she was drinking something, that she felt like a bubble got stuck in her throat. And it happened a few times to her. And at first I was like, what? Really? And I didn't tell Dr. Galloway at this time, but, I was scheduling the appointment. I was like, okay. I just kind of took in all of the different information. And then I shared it with Dr. Galloway. And what we found out, and she'll share her story next. What we found out, though, was that swallow syncope is a rare type of like situational syncope. Syncope is like when you faint, okay, because maybe you've lost blood supply or whatever it is, right? But it's typically due to some reflex when you're swallowing something, and it can be where you're ingesting solid foods or beverages or anything like that. It could be something that has to do with the throat, esophageal, or it can be something to do with like a cardiac disease. And so I want Dr. Galloway, because once I talked to her about it, and she actually saw the patient, she told me this story. So I'm going to have her share her story about this as well.
Yeah. So yesterday I come in and I'm looking at my schedule and I see this patient on the schedule, and I always just like read the notes of what they said on the phone when they were scheduling, what's their big concern. I'm like, what? That's totally random, because about a year ago, my husband went to a brewery with a friend, and they'd just gotten there. It was like a warm day in the afternoon. They got a table on the patio. So they had not been drinking before they got there. They ordered beers, like less than 10 minutes into drinking their beers. My husband took a drink of his beer and then felt like kind of lightheaded, like when you stand up too fast and then you kind of like see stars. But then he actually passed out for a few seconds. And his friend was, there with him, and he like got him a cold rag, and like he came to and all of that. And when he came home, he's describing to me what happened. I'm like, what? And so we're looking it up online, and it is a real thing that happens to people. And so it had never happened to my husband before, and it hasn't happened since. But this patient that I saw yesterday, it's happened to her several times over the course of her lifetime. And she's sort of like, she has tips and tricks to help her. So she said she can kind of feel it's more likely to happen if she drinks something, like tips her head back to drink something rather than drink through a straw. But she said it's most likely to happen when she's having water or something that she's drinking more quickly. But she'll feel like an air bubble or like some pressure in her esophagus. And then she tries to like break. She said if she puts her arms up or something like that, sometimes that can like break up the bubble and it goes away. But she's always kind of afraid that that's going to happen, that she's going to like pass out from it. So we decided that we needed to do a show on it because it's just strange enough, but also common enough that, people have experienced it.
Yeah. And, we try to do some different research spotlights. And we thought this was perfect because we were like, let's look it up because we don't know enough about this. Now, there is something that we as audiologists see and sometimes screen before we do some vestibular testing, which is this vertebral artery insufficiency test, right? Because we don't want people when they tip their head back or turn when we're doing like a Hall pike or something in the dizziness testing that we do, or it's called a VNG, video nice diagram, or even a VAMP, really. We don't want them to pass out by, really compressing that vertebral artery, basilar artery. There we go. I was like, I'm missing something. Basilar artery. And so it's not necessarily that, but we did look it up. And so the diagnosis of swallow syncope really, you can, it's kind of funny, but they actually have you hooked up to an ECG, electrocardiogram, and then they actually have you swallow and do some different, like swallow some different foods or beverages or something like that. But we have this video that I wanted to play because there actually is a physician that talked about this, and I thought we'd play this so that you can listen to it as well.
So swallowing syncope is a form of syncope that occurs when a patient swallows food. This is a particularly difficult form of syncope to treat because the reflexes which then get started or initiated at the point of swallowing is what causes syncope. Now, in my experience, swallow syncope is not very common. When it does occur, it does not occur with the patient swallowing every time. There's certain specific situations which, if you like, have all the ducts lining up in a row for a patient to then faint. So in swallow syncope, this might be when the patient is relatively dehydrated. It's a warm day, the patient's relatively tired maybe, and maybe swallowing an exceptionally big chunk of food that they haven't chewed on properly, and it goes down the wrong way and may cause a slight coughing fit as well. These are what are some of the factors that may contribute to swallow syncope, but of course, the mechanism behind that is still incompletely understood. Treatment for swallow syncope, however, needs to be focused on swallowing properly. So taking very small, bite-sized chunks of food, having a good chew, and making sure swallowing is good. And as well as that, just making sure you're very hydrated, making sure that you're not in a situation where it's too warm and too stuffy and you're feeling unwell prior to the swallow, then and you know that you're a patient who's prone to having syncope while swallowing, then be more careful.
Awesome. Okay, so thank you, Dr. Lim. Okay, so what's interesting is, so we looked up some different articles, and we did find an article. Dr. Galloway found an article talking about what her husband actually experienced. So going back to kind of like that bubble in the throat, right? And we kind of laughed because it was almost exactly like what happened to her husband. And so this one, I'm going to read it pretty quickly because it's pretty short. But it's about a cold beverage induced vasovagal syncope in a healthy young adult man. So I'm like, this is pretty much Dr. Galloway's husband and what happened. And so really the case presentation was a healthy 32-year-old white man experienced a syncopal episode following the ingestion of a cold carbonated beverage on a hot day. He rapidly recovered consciousness and save for mild lightheadedness. All ill effects disappeared within minutes. On examination, no concerns were detected, and he was discharged with the cause being ascribed to esophageal stimulation affected vagus nerve overactivation. So the conclusions on this was that the suddenness and unpredictability of swallowing induced syncope make it a potential dangerous condition with risk both to the patient as well as depending on context. However, it is poorly understood due to its infrequency. And, we thought about this. I know we've got some different statistics because we thought it was kind of interesting. We looked at swallow syncope, but also we looked at vasovagal syncope. And we're talking about this because it's actually a little more common than you think. So I'm going to have Dr. talk a little bit more about that.
Yep. So, okay, the statistics that we have So, vasovagal syncope is a sudden drop in heart rate and blood pressure leading to fainting, often in reaction to a stressful trigger. So I think that probably it's just there's a lot of gray area. But if somebody has had like an episode of syncope, we're trying to figure out what could be the cause of this, right? Um, so for syncope to occur due to this problem, the heart usually has to stop for at least 6 to 10 seconds, which is crazy. Episode is usually brief, and the accompanying symptoms usually disappear quickly. It may take a good 15 minutes before the blood flow to the brain is restored, and that depends on the triggering event. The statistics are very common. So more than 3 million cases in the US per year, usually self-diagnosable, usually self-treatable. I'm surprised that a lot of people don't end up in the emergency room because especially a 6 to 10 second episode of like your heart stopping, that sounds really traumatic. My husband's, which I do think was more of the swallow syncope, was, really brief, and he regained consciousness and then didn't feel 100% great, but, he felt better as time went on. But yeah, I think it's definitely more common than anyone would have thought. So typically the vasovagal syncope episodes occur after standing for a prolonged period of time, and they can be triggered by fasting, dehydration, being in crowded or excessively warm environments, or following stressful events. And so I think too, it's kind of like when you have an anxiety attack and it gives you some like physical symptoms. It's kind of hard too to know. I'm sure it's pretty muddy for people to know exactly what it was that made them lose consciousness, because reading this, it also sounds like something that could happen, with claustrophobia or, panic attack, something like that. So for symptoms, paleness, nausea, sweating, rapid heartbeat, and fainting. So if it's truly vasovagal syncope, it's not an anxiety attack. But like with swallowing, there's a physical reason why it happens. So you swallow something and then you have this response. Whereas with the vasovagal, it seems like it's just more, it's a little harder to put your finger on. So anyway, it's definitely more common than we think.
Yeah. And treatment is kind of interesting. So again, this is more focused on the vasovagal syncope. Sometimes it's medication. Sometimes there's different therapies that can help with the blood flow, especially in your legs, with the fainting part of it. Sometimes it's surgery or pacemakers is what they're saying. And then one thing that we thought too was what we found out was that they're recommending that if you do have this syncopal episode, to not drive for at least 4 weeks. Like they recommend that physicians recommend that you drive, you resume driving after 4 weeks, only if the cause has been identified and treated even. So like what you were saying, what Dr. Galloway was saying too, some people might not even know this is what happened, and might not even think about it. So that's why we're doing this show too. Like at first we thought, that's kind of a weird type of thing to report. Then we actually saw it. Then she actually said, oh my gosh, wait, my husband kind of had some syncope with this, and it's probably the swallow syncope. And then we looked it up, and so it's interesting that this kind of stemmed from just one patient, but we just want to get the information out there so that people know what it is, and if you're experiencing it, right, and what are some of the things that can be done.
The more that I read about the vasovagal, I lost consciousness at a museum one time, and now I'm wondering if that's what it was, because it was crowded. It was kind of hot. I thought maybe it was like low blood sugar, because I've had issues with that in the past. But now that I'm reading the definitions of this, I mean, it could have been that too. So, and I just chalked it up to, it was just an off day. I was claustrophobic. Maybe I didn't eat enough breakfast, something like that. And obviously I don't have any recurring episodes of that, but the patient that we had, she has had recurring episodes over her lifetime, and her dad has also experienced it. And so it's just kind of random, but also more common than we knew.
Yeah. And we even found an article where it talked about a woman that had the swallow syncope that we had talked about, and her brother had the same thing as well. And so they were trying to figure out if it is somewhat hereditary, but there were no conclusive results or studies yet that we saw anyway. But we didn't dive too deep into it, just kind of making sure that we could get prepared for the show and get some information out. So some of the other case studies that we saw as far as treatment, we thought this was kind of interesting. The first one was neuromodulation. And I asked Dr. Gallo, I was like, what does that mean? What do they do in neuromodulation? So we looked into it. Okay, it's neuromodulation, but it is cardiac neuromodulation with a cryo balloon. And I read that to her and she's like, what the heck is that? And I was
sound like something I want to do.
No. So what they did was they took 26 patients in this article that we looked at. They took 26 patients. All of them underwent a successful procedure. And this is what it says. It was a 28 millimeter second generation Arctic front advanced cryo balloon. There was no major complications in the surgery. And then they followed up with them at about 20 months or so from their reflex or their vasovagal syncope. And they said there was freedom. So they probably didn't have another episode from the syncope, at least 83.7%, with 22 of their 26 patients free from any clinical recurrence. And so, yeah, that's a possible treatment, is this cardiac neuromodulation with a cryo balloon, which like, I don't even know. Yeah, I'm not even too sure.
I also I found this other case report that's from Military Medicine, and it was from 2001, so this is over 20 years old. But I liked how it gave this nice little description of how to sort of diagnose and what the treatments are. So it talked about tilt table test. So it says that the tilt table test is now the gold standard. That was 20 years ago, so probably before any neuromodulation. But a tilt of 60 degrees for 45 minutes is a reliable and reproducible method of diagnosis. The other thing that this article said was the article is about vasovagal syncope, but it says that it's commonly associated with sudden stress and is experienced by 2/3 of the population at some time during their life. So also, this is 20 years old, but when I read that, that's when I was like, oh yeah, what about that time at the museum when I lost consciousness? Because that might have been what happened. I have no idea. But anyway, the tilt table test is also, something that's used to diagnose, to make sure that, that's actually what's happening. Although 45 minutes is kind of a long time to be on a tilt table. But
yeah. So, moral of the story is take your patients seriously. Take all of these symptoms that they're telling you about. And I mean, if you're curious, like we're always curious, we're like, what? And we see some really interesting cases, and it stems into some of us, some of the research that we get to look up and really learn about some things that we've never even seen, even in our careers, right? Or even in our industry as well. So we thought we'd share that with you. We thought it was super interesting. And then again, I was shocked to hear that Dr. Galloway's own husband also had something similar. So we thought it was enough to look it up and learn a little bit more about it so that we'd be a little more well-versed on the symptoms and know what kind of patients are walking through our doors. So.
Well, and I think if you see dizziness or balance patients, dizziness is so hard because a lot of people say, well, I don't have vertigo, I'm not spinning, I'm just lightheaded. And so it's like, okay, is this cardiovascular? Is this truly something that's vestibular? Could it be, something that has to do with some other totally different factor? And so it's been interesting to see balance patients because sometimes, they'll describe their history. We get a totally normal peripheral balance test. It's like, okay, maybe cardiology, maybe neurology. The patient that I just saw this week, she had already been to cardiology, and they pretty much said that because she already has kind of historically low blood pressure, the one treatment that they would recommend, they didn't recommend for her because, and I believe she said it was a calcium blocker. But because her blood pressure is already like historically low, they didn't think it would be a good choice for her. So there are some things, that can be tried. But it doesn't sound like, there's a huge common treatment, that works for everybody. So
Yeah. So again, we are live here every Thursdays at 12:30 p.m. Mountain Standard Time. If there's something that you want us to cover, send it our way. Send us a comment in the live show wherever you're watching. We're on Facebook, we are on YouTube, and also on LinkedIn. And then we also post it in our Instagram as well. So as you can see on the bottom, follow us on social media, follow and subscribe to our YouTube channel to find our episodes faster. And if you've got something that you want us to cover, please feel free to send it our way, and we will get it on a show and talk about it. So
yes, and if you've ever had an episode of something like this, let us
Mhm.
know, because now that I'm reading 2/3 of the population, let us know if you or a patient or somebody that you know has had something like this happen, because we might have a name for it now.
Yes, or share this out and share the information out to them too, so that they know that they're not alone, because it does happen frequently.
Yeah.
So yeah. All right. With that, we'll see you next week, you guys. And thanks for tuning in. And we will be back next week, Thursday, 12:30 p.m. Mountain Standard Time. All right. We'll see ya.
Thanks.